ASD Mental Disorder. Introduction to Autism Spectrum Disorder, ASD. Autism Spectrum Disorder, ASD, is a complex neurodevelopmental condition characterized by challenges with social interaction, communication, and repetitive behaviors. The term spectrum reflects the wide range of symptoms, skills, and levels of disability that can occur in individuals with ASD. Understanding ASD involves delving into its history, causes, diagnostic criteria, and treatment options, as well as examining the lived experiences of those affected by it. History of Autism Spectrum Disorder. The history of autism dates back to the early 20th century. Austrian psychiatrist Leo Kanner first described autism in 1943, noting a distinct set of behaviors in a group of children he studied. Around the same time, Hans Asperger, a German scientist, identified a similar condition in children who displayed social difficulties but had better linguistic and cognitive skills. These early observations laid the groundwork for our current understanding of ASD. Causes and risk factors. The exact causes of ASD are not fully understood, but it is widely accepted that a combination of genetic and environmental factors plays a role. Studies have identified several genes associated with the disorder, and research continues to explore how these genetic factors interact with environmental influences, such as parental age, pregnancy complications, and prenatal exposure to certain substances. Diagnostic criteria and tools. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association, provides the criteria for diagnosing ASD. The DSM-5 identifies two main areas of impairment: social communication and interaction, and restricted, repetitive patterns of behavior, interests, or activities. Diagnosis typically involves a comprehensive evaluation by a team of specialists, including psychologists, neurologists, and speech therapists, who assess the individual's developmental history, behavior, and communication skills. Symptoms and characteristics. ASD manifests differently in each individual, but common symptoms include difficulties with social interaction, challenges with verbal and nonverbal communication, and repetitive behaviors or interests. These symptoms can range from mild to severe, and individuals with ASD may also have co-occurring conditions such as intellectual disabilities, anxiety, ADHD, or epilepsy. Social interaction and communication. People with ASD often struggle with social cues, making it difficult to form and maintain relationships. They may have difficulty understanding body language, facial expressions, and tone of voice. Communication challenges can vary widely. Some individuals may be nonverbal, while others may have advanced language skills but struggle with conversational nuances. Repetitive behaviors and restricted interests. Repetitive behaviors are a hallmark of ASD. These can include hand flapping, rocking, or insistence on routine. Many individuals with ASD have intense, focused interests in specific topics, which can be a source of joy and comfort but may also limit their engagement with other activities. Sensory sensitivities. Many people with ASD experience sensory sensitivities, reacting strongly to certain sounds, lights, textures, or smells. These sensitivities can affect daily life and lead to overstimulation or distress in environments that others find tolerable. Early signs and diagnosis. Early diagnosis and intervention are crucial for individuals with ASD. Parents and caregivers are often the first to notice developmental delays or unusual behaviors. Early signs may include a lack of eye contact, delayed speech development, and limited interest in social interactions. If ASD is suspected, a thorough evaluation by a medical professional is necessary to confirm the diagnosis. Treatment and intervention. While there is no cure for ASD, various treatments and interventions can help individuals manage symptoms and improve their quality of life. These may include behavioral therapies, speech and language therapy, occupational therapy, and educational support. Applied behavior analysis, ABA, is one of the most widely used therapeutic approaches, focusing on reinforcing positive behaviors and reducing negative ones. Educational support. Education is a critical component of intervention for children with ASD. Individualized education programs, IEPs, are designed to meet the unique needs of each student, providing tailored support and accommodations in the classroom. Inclusion in mainstream education, along with specialized support, can help children with ASD develop social and academic skills. Family support and resources. Caring for a child with ASD can be challenging for families. Access to resources and support networks is essential. Parent training programs, support groups, and respite care can provide much-needed assistance and guidance. Families may also benefit from connecting with organizations such as the Autism Society and Autism Speaks, which offer a wealth of information and advocacy. Adults with ASD. As awareness of ASD has grown, so has the recognition of the needs of adults with the disorder. Transitioning to adulthood can be challenging, as individuals with ASD may face difficulties in higher education, employment, and independent living. Vocational training, supported employment programs, and life skills coaching can help adults with ASD navigate these transitions and achieve greater independence. Research and advances. Ongoing research is crucial to advancing our understanding of ASD. Scientists are exploring the genetic and neurological underpinnings of the disorder, as well as developing new therapeutic approaches. Advances in technology, such as brain imaging and genetic testing, hold promise for improving diagnosis and treatment. Public awareness and advocacy. Increased public awareness and advocacy have been instrumental in improving the lives of individuals with ASD. Advocacy efforts have led to greater acceptance and inclusion, as well as increased funding for research and services. World Autism Awareness Day, observed on April 2, is one example of a global initiative to raise awareness and promote understanding. Legal rights and protections. In many countries, individuals with ASD are protected by laws that ensure their rights to education, employment, and healthcare. In the United States, the Individuals with Disabilities Education Act, IDEA, guarantees free and appropriate public education for children with disabilities, while the Americans with Disabilities Act, ADA, prohibits discrimination based on disability. Cultural perspectives on ASD. Cultural attitudes towards ASD can vary widely, influencing how the disorder is perceived and treated. In some cultures, there may be stigma or misconceptions about autism, while in others, there may be strong support and advocacy. Understanding these cultural differences is important for providing effective support and promoting acceptance. Personal stories and experiences. Hearing directly from individuals with ASD and their families can provide valuable insights into the daily challenges and triumphs associated with the disorder. Personal stories highlight the diversity of experiences within the autism community and emphasize the importance of empathy and understanding. The future of ASD. Looking ahead, there is hope for continued progress in the field of autism research and treatment. Advances in early detection, personalized therapies, and support services hold promise for improving outcomes for individuals with ASD. Greater societal acceptance and inclusion will also play a crucial role in ensuring that people with autism can lead fulfilling and meaningful lives. Conclusion. Autism spectrum disorder is a multifaceted condition that affects millions of individuals and families worldwide. By understanding its history, causes, symptoms, and treatments, as well as the lived experiences of those with ASD, we can work towards a more inclusive and supportive society. Ongoing research, advocacy, and education are essential for advancing our knowledge and improving the quality of life for individuals with autism. Detailed examination of autism spectrum disorder. Neurological basis of ASD. Research into the neurological basis of ASD has revealed differences in brain structure and function. Studies using magnetic resonance imaging, MRI, and other neuroimaging techniques have found variations in the size and connectivity of certain brain regions in individuals with ASD. For example, abnormalities in the amygdala, which is involved in emotion processing, and the prefrontal cortex, responsible for executive functions, have been observed. Genetic factors. Genetics play a significant role in the development of ASD. Twin and family studies have shown that autism has a strong hereditary component. Researchers have identified several genes associated with the disorder, and it is believed that multiple genetic mutations and variations contribute to the risk of developing ASD. These genetic factors can influence brain development and function, leading to the symptoms observed in autism. Environmental influences. While genetics are important, environmental factors also contribute to the development of ASD. Prenatal exposure to certain substances, such as valproic acid or thalidomide, has been linked to an increased risk of autism. Additionally, complications during pregnancy and childbirth, such as premature birth or low birth weight, may be associated with a higher likelihood of ASD. However, it is essential to note that no single environmental factor is responsible for causing autism, and the interplay between genetics and environment is complex. Co-occurring conditions. Many individuals with ASD have co-occurring medical or psychiatric conditions. These can include 1. Intellectual disability. Some individuals with ASD have varying degrees of intellectual disability, affecting their cognitive and adaptive functioning. 2. Anxiety disorders. Anxiety is common among people with autism, manifesting as social anxiety, generalized anxiety, or specific phobias. 3. Attention deficit/hyperactivity disorder, ADHD. Many individuals with ASD also exhibit symptoms of ADHD, such as impulsivity, hyperactivity, and difficulty sustaining attention. 4. Epilepsy. Seizure disorders are more prevalent in individuals with ASD compared to the general population. 5. Gastrointestinal issues. Digestive problems, such as constipation or diarrhea, are frequently reported in people with autism. Early intervention. Early intervention is crucial for improving outcomes for children with ASD. Research has shown that early, intensive behavioral and educational interventions can significantly enhance cognitive, social, and adaptive skills. Interventions may include 1. Applied behavior analysis. ABA is a structured approach that uses positive reinforcement to teach new skills and reduce problematic behaviors. 2. Speech and language therapy. This therapy focuses on improving communication skills, including speech, language comprehension, and social use of language. 3. Occupational therapy. Occupational therapists help individuals with ASD develop fine motor skills, sensory integration, and daily living skills. 4. Social skills training. Programs that teach social skills can help individuals with autism navigate social interactions and build relationships. Educational strategies. Educating children with ASD requires individualized approaches that cater to their unique needs. Key strategies include 1. Individualized education programs, IEPs. IEPs are tailored plans that outline specific educational goals, accommodations, and services for each student with ASD. 2. Inclusion, including students with autism in mainstream classrooms, with appropriate support, can promote social integration and academic achievement. 3. Visual supports. Visual aids, such as schedules, charts, and pictograms, can help individuals with ASD understand and follow routines. 4. Assistive technology. Devices and software that support communication, learning, and organization can be beneficial for students with autism. Transition to adulthood. Transitioning to adulthood poses unique challenges for individuals with ASD. Supports and services are essential to help them achieve independence and succeed in various aspects of adult life, including 1. Higher education. Colleges and universities are increasingly providing accommodations and support services for students with ASD. These may include academic coaching, social skills training, and sensory-friendly environments. 2. Employment. Vocational training and supported employment programs can help individuals with autism find and maintain jobs. Employers are also becoming more aware of the strengths that people with ASD can bring to the workplace. 3. Independent living. Life skills training, such as budgeting, cooking, and transportation, is crucial for helping individuals with ASD live independently. Supported living arrangements, such as group homes or assisted living facilities, may also be available. 4. Social relationships. Building and maintaining social relationships can be challenging for adults with autism. Social skills groups, dating coaching, and support networks can provide valuable assistance. Research advances. Research into ASD is continually evolving, with several promising areas of investigation. 1. Genetics and genomics. Advances in genetic research are identifying specific genes and genetic variations associated with autism, providing insights into its biological underpinnings. 2. Neuroimaging. Neuroimaging studies are enhancing our understanding of brain structure and function in individuals with ASD, revealing patterns that may inform diagnosis and treatment. 3. Early detection. Researchers are developing tools and techniques for earlier and more accurate diagnosis of ASD, including biomarkers and advanced screening methods. For personalized medicine, there is a growing focus on personalized approaches to treatment, tailoring interventions to the specific needs and characteristics of each individual with autism. Public awareness and advocacy. Raising public awareness and advocating for the rights and needs of individuals with ASD are crucial for promoting acceptance and inclusion. Key efforts include 1. Awareness campaigns. Initiatives such as World Autism Awareness Day and Autism Awareness Month aim to increase public understanding and reduce stigma. 2. Advocacy organizations. Organizations like Autism Speaks, the Autism Society, and the National Autistic Society work to advocate for policies and practices that support individuals with ASD and their families. 3. Legislation. Laws and policies that protect the rights of individuals with autism, such as the IDEA and ADA in the United States, are vital for ensuring access to education, employment, and healthcare. Cultural perspectives. Cultural attitudes towards ASD can significantly impact diagnosis, treatment, and acceptance. Understanding these cultural differences is important for providing effective support. For example, 1. Stigma and misconceptions. In some cultures, there may be stigma or misunderstandings about autism, leading to delayed diagnosis and limited access to services. 2. Community support. In other cultures, strong community and family support networks can provide valuable assistance and promote acceptance of individuals with ASD. 3. Cultural competence. Healthcare and educational professionals must be culturally competent to effectively support individuals with autism from diverse backgrounds. Personal stories. Personal stories from individuals with ASD and their families offer valuable insights into the diverse experiences and challenges associated with the disorder. These narratives highlight the importance of empathy, understanding, and support. The future of autism spectrum disorder. The future of ASD research and treatment is promising. Continued advancements in early detection, personalized therapies, and support services hold the potential to significantly improve the lives of individuals with autism. Increased societal acceptance and inclusion will also play a crucial role in ensuring that people with ASD can lead fulfilling and meaningful lives. Conclusion. Autism spectrum disorder is a multifaceted condition that affects millions of individuals and families worldwide. By understanding its history, causes, symptoms, and treatments, as well as the lived experiences of those with ASD, we can work towards a more inclusive and supportive society. Ongoing research, advocacy, and education are essential for advancing our knowledge and improving the quality of life for individuals with autism. Additional sections. Therapeutic approaches and innovations. Recent years have seen significant advancements in therapeutic approaches for ASD, including 1. Cognitive behavioral therapy, CBT. CBT is effective in addressing anxiety, depression, and other co-occurring conditions in individuals with ASD. 2. Social stories. Social stories are short, descriptive narratives that explain social situations and appropriate responses, helping individuals with autism navigate social interactions. 3. Play therapy. Play therapy can enhance social, emotional, and cognitive development in children with autism by using play-based activities to promote learning and interaction. 4. Mindfulness and relaxation techniques. These techniques can help individuals with ASD manage stress and anxiety, improving overall well-being. Technology and ASD. Technology plays an increasingly important role in supporting individuals with ASD. Some key innovations include 1. Augmentative and alternative communication (AC) devices. AC devices, such as speech-generating devices and communication apps, help nonverbal individuals or those with limited speech communicate effectively. 2. Virtual reality (VR). VR technology is being used to create immersive environments for social skills training, helping individuals with ASD practice interactions in a controlled setting. 3. Wearable technology. Wearable devices that monitor physiological responses can help individuals with autism manage sensory sensitivities and anxiety. For educational software, specialized educational software and apps provide interactive learning experiences tailored to the needs of individuals with ASD. Impact of ASD on families. Having a family member with ASD can significantly impact the entire family. Key areas of impact include 1. Emotional and psychological. Families may experience a range of emotions, including stress, anxiety, and grief, as they navigate the challenges of supporting a loved one with autism. 2. Financial. The cost of therapies, medical care, and educational support can be substantial, placing financial strain on families. 3. Social. Families may face social isolation due to the demands of caring for a child with ASD and the stigma that can be associated with the disorder. 4. Resilience and adaptation. Despite the challenges, many families develop resilience and find strength in supporting their loved one with autism. Autism and gender. Research indicates that autism manifests differently in males and females, with males being diagnosed more frequently. Key points include 1. Gender differences in symptoms. Females with ASD may exhibit different symptoms than males, such as more subtle social communication difficulties and fewer repetitive behaviors. 2. Diagnostic bias. Diagnostic criteria and tools have traditionally been based on male presentations of autism, leading to underdiagnosis and misdiagnosis in females. 3. Research and awareness. Increasing awareness of gender differences in autism is leading to improved diagnostic practices and tailored interventions for females with ASD. Global perspectives on ASD. Autism is a global phenomenon, and understanding how it is perceived and addressed in different countries is important for fostering a comprehensive approach to support. Key points include 1. Access to services. Access to diagnostic and therapeutic services for autism varies widely across countries, influenced by factors such as healthcare infrastructure and socioeconomic status. 2. Cultural attitudes. Cultural beliefs and attitudes towards disability and mental health can affect how autism is perceived and treated in different regions. 3. International collaboration. Global initiatives and collaborations, such as the World Health Organization's efforts to improve autism awareness and support, are crucial for addressing the needs of individuals with ASD worldwide. Conclusion. Autism spectrum disorder is a complex and multifaceted condition that requires a nuanced and comprehensive understanding. By exploring its history, causes, symptoms, and treatments, as well as the lived experiences of those affected by it, we can work towards a more inclusive and supportive society. Ongoing research, advocacy, and education are essential for advancing our knowledge and improving the quality of life for individuals with autism. As we continue to learn and innovate, the future holds promise for more effective interventions, greater acceptance, and improved outcomes for people with ASD. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.